Support comes from the Missouri Forest Products Association, providing more than 41,000 jobs in the production of wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details at choosewood.com.
Welcome to St. Louis on the Air. I'm Sarah Fenske. Dr. Alex Garza is the incident commander of the St. Louis Metropolitan Pandemic Task Force. And yeah, that's probably about the most important title you'll hear on this show anytime soon. He joins us today to explain where our region is at in its fight with the coronavirus. So, Dr. Garza, welcome to the show.
Thank you. Pleasure to be here.
Now, there's just been so much speculation about when Greater St. Louis is going to hit the peak of that coronavirus curve. What is your current best estimate on that?
Yeah, so our current best estimate, and I will emphasize best estimate because these are never precise, is going to be in around a week. So the number where we believe the most number of hospitalizations that we'll have will occur on or around April 25th. But again, that's based off the modeling data that we had when we last ran the model, which was about a week ago. And so every week we get more data, we rerun our models, and so that date can shift one way or the other. But as of right now, that's when we believe the peak is. Now, let me talk to you a little bit about what peak means, though. So it's not, don't vision it like a mountain where there's like we do this steep climb and then hit a point and then have this steep drop off. This is more of almost like a rolling hill. So we accumulate hospitalizations over this period of time, and we think that we'll have the most number of hospitalizations on or around the 25th, and then we'll gradually come back down. And part of that is because of all of the, social distancing and shelter-in-place rules that we've had in place.
This curve would have looked a lot different without that.
Yes, yeah, it would have looked like that mountain had we not done or had our elected officials particularly not taken the action that they did.
So you're talking about this happening next week in terms of the peak of hospitalizations. Will the peak of deaths likely be a bit after that then, or are we looking at that as being roughly in that same time frame?
Yeah, it's hard to say, and I can't give you an exact answer, but if I think about this logically, we know that a certain percentage of people that are hospitalized in intensive care, really sick patients, are going to succumb to the disease. And we know how long patients typically stay in our ICUs and on ventilators. And so if we use that logic, then we would probably see that mortality increase about a week to 10 days after the peak.
Okay. So things could be kind of dicey for the next couple weeks.
Correct.
Okay. So what do your current projections show about whether this is going to be the sort of swamp to our local healthcare systems that we were all so worried about on the front end? Yeah,
well, we were worried about that on the front end. And I think, and part of that, again, was based on modeling. And people have probably heard me talk about our modeling. It looks like a hurricane model where the further out you go, the less predictability you have. Mm-hmm. And so early on in this, when we were taking a look at data and what was coming out of Europe and other places, and then plotting that to what the St. Louis metropolitan area looked like, we got back some pretty scary numbers. And so when we took a look at those, we said, well, how could we meet that demand? And then that's when we started pulling our hospital systems together to start looking at capacity. So right now, given the rerunning of the model and the updated data and what we think the cases are, we'll be a little bit stressed, but we believe that we can handle, that level of patients within our healthcare system. Now, when I say that, it's not like we're doing normal operations. We're still operating under crisis standards of care. And so we've converted, and when I say we, it's really the collective we of the healthcare systems have converted, entire floors to housing COVID patients and entire ICUs that do nothing but take care of COVID patients. And so, and then in addition, we still have what we term as sort of our normal sick population as well that we need to take care of. And so there's no other things going on right now outside of taking care of really urgent, emergent cases and COVID. So there's no elective surgery going on. There's no other things going on. And so we're operating under a different model right now, but we've built enough capacity into the system that we should be able to handle that number of cases.
So we have all hands on deck, and that's why we're going to be okay when we hit the peak of that curve. So we were always told that the idea was to give healthcare providers time to get those sort of things in place, that we wanted to be ready for when this peak was going to hit. So if we hit the peak and our system handles it and things start to go down, is that enough to say that, yeah, we can start to open up in the St. Louis area again?
Yeah, that's a really cautious question. So we certainly do not want to say, yes, we're past the peak, let's throw open the doors and let everything go back to normal. Because we know virus is still circulating within the community. And so if you think about, and you're absolutely right, that part of the reason for practicing all of the shelter-in-place and social distancing was to decrease the rate of spread, because we knew if we were going to be on a trajectory of like in Italy or France or Spain, that the healthcare system would be completely overwhelmed. And so what does that translate into? So that translates into a lot of death. So not only death from COVID patients, but deaths to other patients that we could have potentially also saved that would not get the attention and care that they deserved either. And so that's really what came up with our simple slogan of, stop spread, save lives. It's not just for COVID, it's for everybody. So now, but getting back to your question about, okay, so now that we've reached this peak, we know that peak, as I said, is more like a rolling hill, so it's going to take some time for those cases to start coming down. And so we'll need some time to recover from that. We're also buying time to get caught up with personal protective equipment, to get caught up with medical therapeutics, all of those things. And if we open too fast, too soon, it's pretty clear that the virus will ramp back up.
We'll get that second wave.
Yes, we'll again begin to spread again, and we will then have another wave of patients coming at us. For which we wouldn't be prepared for, and so it's this we call it the dance, and so it's how much can I open, how fast, how soon, while still being able to manage the virus. So the virus doesn't care if the economy is open or not. All it's doing is looking for a host to replicate, and so if it can find that, then it's going to go. And so we have to be really cognizant that. We're not the only ones playing in this game. It's the virus as well.
We're talking to Dr. Alex Garza. He's the incident commander of the St. Louis Metropolitan Pandemic Task Force. And if you have a question for him, specifically as it relates to our regional response to the coronavirus or what we should be doing next, give us a call, 314-382-8255. That's 382-TALK. Or you can send us a tweet at STL on air or email us at talk@stlpublicradio.org. We did get a question on Twitter from Blake Brown, and he tweets, does Dr. Garza consider that a second wave will happen no matter how long we wait, that maybe the virus is simply going to do what it will do no matter what, and that we can't hide from it forever? That's certainly a thought I'm hearing expressed these days. What are your thoughts on that?
Yeah, so we certainly can't hide from the virus forever, and that's exactly right. So, but we have to be very focused on how can we manipulate the virus's strategy. And so I'm going to use a little bit of my career in the military here. When you're battling an enemy, the goal isn't really to just attack the enemy. It's really to defeat the strategy. So think about the virus's strategy. The virus's strategy, its only strategy, is really to stay alive and replicate. That's the only thing. It doesn't care like who you are or where you live or anything like that. So in answer to the question, then, yes, the virus is going to do what it's going to do. But if we can impact the strategy of transmission, that does all of those other things that I mentioned previously. It decreases morbidity and mortality in our population. It allows the healthcare systems to deliver effective and efficient care for everybody, not just for COVID patients. And quite frankly, it allows the economy to come back at a gradual pace rather than opening up and being decimated by a huge number of cases coming back. If you look at the 1918 influenza pandemic, which St. Louis is rightfully given credit for really decreasing the amount of death when it was first noticed, then Mayor Keel put in a heavy dose of social isolation and shelter in place, and we were credited with having a very low mortality rate. And the exact same thing happened. And so people got accustomed to, well, we're doing very well with influenza, let's open up the economy again, and that's what he did, only to be overcome by a second wave, which caused more death than the first. So we absolutely want to avoid that from happening.
Yeah, that does seem like a good goal. We certainly don't want the second wave to be worse than this first wave, because, man, this first wave has been something. I'm curious if you've seen, there's a new study that came out of Stanford. I believe it just broke this morning, where they went around and tested a random sample of the population, and they're suggesting the rate could be 50 times higher than what we now know. What do you make of that?
I am not surprised by that, and so I just read the headline right before I jumped on the phone with you. And so if you think about some of the statistics that we've been putting out as the task force, we've sort of mirrored that, where we've said, hey, we believe there's going to be 71,000 cases in the St. Louis metropolitan area by the end of April. And the way to describe that is that's not 71,000 people that have been tested positive. That's 71,000 people that have actually had the virus. And so it's a little bit misleading, and I always cringe a little bit when people put out, this is the number of cases that have been identified in the state or in the county. That is always limited by our testing capacity. So really what you're saying is this is the number of tests that we've done. It isn't the number of cases. We've had multiple times more cases in our community. We just didn't know it. 30% of people with coronavirus are walking around without any symptoms at all. And then there's a healthy percentage that have had minor symptoms that have never bothered to get tested. And then there's some, these testing centers are still relying on a very restrictive protocol before they'll do testing. And so some people could have had abnormal symptoms or different types of symptoms and never been tested.
Do you have any sense of when we might have enough tests within this region that'll change, that we'll be able to get a truer sense of how many people here have had it or currently even have it?
Yeah, that's a great question, and one that's asked frequently. So if you think about testing, there's two different types of testing. One is the one that we talk about a lot today, which is the PCR test, or polymerase chain reaction. And that is a test that's used to look for active infection. And that's the one that places like South Korea and Germany did a lot of testing early on to identify who was sick and who wasn't. So that's your population surveillance. That is the one that we've been, that has been rate limited, where we haven't had the supplies that we need in order to do massive amounts of testing, which is why really only sick people are getting tested right now, because we just don't have the supplies that we need. Now, I don't see that changing in the near future. It's merely a production and a supply chain issue. And we're competing with every other metropolitan area. We're competing with every other healthcare system. We're competing with the federal government on a limited supply. And so I don't see that changing in the near future. Now, the other test that's coming online and should be available come May sometime is the antibody-based testing. And what that looks for is immunity in the population. And so it may be a better idea to not worry so much about, when I say worry, I mean like we don't think we're going to have the supplies anyway for that PCR-based testing.
Yeah, we're just not going to get it. So maybe move on from that, move to the antibody?
Yeah, exactly. So focus on the antibody test, where we believe that we can do a large amount of testing on that antibody platform.
We did get a good question from Twitter. Susan asks, are the antibody tests that are now available, like that of Arc Labs and Creve Coeur, are those dependable? Should we wait for other FDA-approved tests?
Another good question. So there was a recent article in Time that called antibody testing the wild, wild west. And it's absolutely true. So the FDA, during these times of extremis with the pandemic, has really loosened the rules on testing that can go out onto the market. So I believe only one of those tests has been approved by the FDA. Now, there's certainly, there's certainly companies out there that are doing very good test building, test kits, things like that. But there is also a number of companies that are really playing fast and loose with the rules. And by that, I mean they will advertise that their tests are FDA approved when they're not, or that they can provide a diagnostic test. Diagnostic, we usually mean to say acute infection, like you're actually infected with it rather than immune, which it doesn't. And the other piece is so two other things. A lot of them have never been validated for how good they are, so how accurate of a test it is. Mm-hmm. And the other one is they haven't been validated on whether they can distinguish between other more common coronaviruses, things that cause a common cold, and the novel coronavirus, which is called SARS-CoV-2. And so those are all of those things that need to be proven before we can validly say this is a good test. And to my knowledge, we haven't found any yet. By we, I mean we in the healthcare system have not found one yet that has met all of those marks, although we are working with testing companies to validate all of their tests that are coming on board. And we do believe that we will be able to do all of those validation tests and have one ready to go by sometime in May.
Okay. So you're thinking we're close to that, but it sounds like you're saying take caution with anything currently available in the St. Louis market now.
Absolutely.
Okay.
Yes.
Well, that's some good advice because I know people are really interested in that question right now.
Right.
People should proceed with caution. I want to go to the phone lines. Marianne is calling from Sunset Hills. Marianne, hi, you're on St. Louis on the air.
Hi. With regard to opening the economy back up, could we look into people wearing face shields if they go to a restaurant, or a face mask, but you can't really wear a face mask when you go to a restaurant? But
yeah, that seems like it might be hard to eat with a shield on or a mask on, but
maybe if everybody coming into the restaurant has a face shield and the workers, has anybody been looking at using face shields versus the masks?
That's a great question, Marianne. Thank you for that. Dr. Garza, any thoughts on that?
Yeah, so I'm assuming again that you don't want to eat with a face shield on either.
That's a safe bet.
A challenge, or maybe something with a straw. But anyway, so yes, so I think the question is really good, but let me expand on it a little bit. So when we're thinking about what would it take to reopen the economy and then how would you reopen the economy, again, I think we have to really distill it down to what sorts of things can we do to reopen the economy while still controlling the risk for transmission. So again, we have to get back to that strategy of the virus, which is transmission. And so that may mean things like if we choose to open restaurants, that we make sure every other booth is blocked off, so we create distance between diners. And that people coming into the restaurants, maybe when they come in, they have to wear the mask, but of course would take it off when it comes to eating and things like that. So it's those and then, you would limit the number of patrons that you could have inside the restaurant as well. And so it's those sort of strategies that, again, all lead back to what are the things that I can do realistically to decrease risk of transmission. And then, making sure there's a very strict cleaning policy, hand washing policy, all of those things going on in addition to those other things that I talked about.
So it definitely won't be business as normal when we begin to reopen.
Right.
That was a great question from Marianne. Let's go back to the phone lines. Aggie is calling from St. Louis. Aggie, hi, you're on St. Louis on the air.
Hello, Dr. Garza. Thanks for all you're doing. I have a question about maternity care in our local hospitals. What are we doing special for moms that are about to deliver? And their babies, of course.
Yeah, that's a great question. So we're taking all of the precautions that we've been taking with taking care of our other patients. And so some of that is, limiting our visitor policy. So they are one of the carve-outs, though, in our visitor policy. So, of course, you would want, your loved one there with you for the delivery and things like that. But limiting our visitors, making sure that, we're practicing all of the proper personal protective equipment around patients. doing all of the things that we would normally do with hand hygiene, keeping surfaces clean, things like that. We don't deliberately test every pregnant person that comes in unless there's a reason to suspect that there would be a COVID exposure or active infection. But again, we do those sorts of things as well in order to protect both our healthcare workers as well as the patients and the children. I know that our NICUs, or our neonatal intensive care units, have a very strict visitor policy now as well in order to protect those babies.
Aggie, thank you for that question. Let's go to David calling from San Francisco. David, hi, you're on St. Louis on the Air.
Oh, yeah, morning. I'm a former St. Louis native, so I'm, greetings to everybody out there.
Thank you for still caring about us. We appreciate that.
Well, sure. February 5th is pretty much when San Francisco shut down.
Mm-hmm. Y'all were very early.
Yeah, that's right. We're going on, 10 weeks, basically. We lost probably $1 billion a week. We were going to, our convention center had a show that closed out, and one of the participants in the convention turned out to have been infected. So the mayor here was courageous enough just to shut the whole convention center down. We were about to have the Facebook convention, which would have been massive, people from all around the world, all of demographics, and that would have been followed by Game Show, another $1 billion worth of show, which would have brought in demographics from all around the world. We shut it down, and as of this morning, our death count in San Francisco is 17 people.
Yeah, that's amazing. I mean, Dr. Garza, does that give you some hope there that with these types of measures that this virus can be tamed?
Yeah, well, I think that just proves the point, and thank you for calling in all the way from San Francisco. I think it reinforces the point that in order to, and I sort of tell people to walk it back. So if you look at the death number, that is a proportional representation of people that were really sick. And that is a proportional number of people that were sick in general. And then that is a reflection of how many people were infected in the population. So we know these percentages that we're playing with people that are infected. And the way that you prevent from becoming infected is to decrease transmission. So you'll hear me keep going back to that strategy of the virus. And so the key to that is to stop the spread. And in order to stop spread, people have asked questions like, well, these are like old-fashioned rules with shelter in place and things like that. And shouldn't we be more able to do different things in this new economy with electronic? And my answer to that is no, the virus doesn't care, if we have the internet. The virus doesn't care if we can do Zoom meetings now rather than in-person meetings. But what technology does do is it gives us the ability to carry on some aspect of our society without risking transmission. So if you think about, past pandemics, without this ability, really society shut down as a whole. But technology, what it does is it allows us to carry on not all aspects, but some aspects of the economy without increasing the risk of transmission. But again, I think that low death number really does reflect that those tried and true methods for decreasing spread really do work.
Well, Dr. Garza, I know we've gone longer than we even said we would go today, but we've had such good questions. I just have one last one for you, and that is, what does success look like to you for the St. Louis area during this pandemic?
Yeah, no, that's a great, and that's a complex question as well. So, overall success would be, we are able to get through this pandemic, and this pandemic is not going to be over, in a month, in 2 months. We'll be dealing with this until vaccine comes along. So just a level set. Now that doesn't mean we're going to be in shelter in place until vaccine comes along, but we're going to have constant community spread and constant people getting sick. Just depends on the level. So I think success looks like able to control the transmission, which keeps the number of infections down, keeps the number of deaths down, able to open up society at a reasonable pace while having those protective functions through public health, things like that, so that we can identify and squash any outbreaks. And again, buying us time until we can get to that vaccine.
Well, I like the sound of all that, and it feels doable. So I hope we can hang in there and get that success for you. So, Dr. Alex Garza, thank you so much for joining us today.
Anytime. Thank you.
And thank you for the work you're doing.
Oh, absolutely.
And Dr. Garza, again, is the incident commander of the St. Louis Metropolitan Pandemic Task Force. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association, committed to conservation and careful management of the state's forests to make them more resilient and better habitats for wildlife. ChooseWood.com.